Have you ever stopped taking an antibiotic after a few days because you started feeling better? Many people have. You may think, I feel fine now, so why do I need to keep taking this medication? However, the decisions we make about antibiotic use can play a role in antibiotic resistance, which is making some bacterial infections more difficult to treat. As an LPN and someone currently continuing my education, I have learned how important antibiotics are in treating infections. I have also researched this topic using reliable sources to better understand antibiotic resistance, why it's a growing concern, and what we can do about it. This topic is relevant to all of us because most of us will either need an antibiotic at some point or know someone who does. Understanding when and how antibiotics should be used can help. Today I will discuss 3 important areas of antibiotic resistance: how antibiotic resistance happens, why it matters, and how we can help prevent it. To understand why antibiotic resistance is such a serious issue, we first need to understand how it happens. First, it's important to understand that it is bacteria that becomes resistant to antibiotics, not our bodies. Antibiotics are medications designed to kill bacteria or prevent them from growing. When bacteria are exposed to an antibiotic, most of the bacteria that are sensitive to the medication may be killed. However, some bacteria may naturally have characteristics that allow them to survive. Those surviving bacteria can then continue multiplying and spread their resistance. According to a 2024 article by Abbas, Barkhouse, Hackenberg, and Wright, published in the journal Cell Host and Microbe, antibiotic resistance is a natural microbial survival mechanism. Bacteria can develop resistance through genetic changes, and they can also acquire resistant genes from other bacteria. The problem can become worse when antibiotics are overused or used incorrectly. For example, antibiotics do not work against viruses such as the common cold or flu. Antibiotics, when they are not medically necessary, exposes bacteria to the medication and creates additional opportunities for resistant bacteria to survive. It's also important to follow the instructions given by a healthcare provider when taking an antibiotic. Patients should take antibiotics exactly as prescribed and should never save leftover antibiotics or share them for another person. Different infections can require different medications, doses, and lengths of treatment. Understanding how antibiotic resistance happens is only part of the story. Next, let's look at why this is such a serious public health concern and why it matters to us. Antibiotic resistance matters because infections that were once relatively easy to treat can become much more difficult to manage. According to a 2024 review by Halawa and colleagues published in Frontiers in Pharmacology, antibiotic resistance involves multiple mechanisms that allows bacteria to survive medications that would normally kill them or stop their growth. Resistant bacteria can also spread between people, communities, healthcare facilities, animals, and the environment. When infection is resistant to commonly used antibiotics, healthcare providers may have fewer treatment options. They may need to use different antibiotics that can be more complicated to administer or may have additional risks and side effects. Treatment can also take longer. Antibiotic resistance is especially concerning in healthcare settings. Think about how much modern medicine depends on our ability to control bacterial infections. Patients undergoing surgery, cancer treatments, organ transplantation, or other medical procedures can be vulnerable to infection. Effective antibiotics are an important part of keeping these patients safe. Resistance can also affect people who were not responsible for the original misuse of an antibiotic. Resistant bacteria can spread from one person to another. This means antibiotic resistance is not only an individual issue, it is a public health issue. The more resistance spreads, the fewer effective treatment options healthcare providers may have for certain bacterial infections. Now that we have discussed why antibiotic resistance matters and why it's such a serious health concern, let's discuss how it can be prevented. There's no single solution to antibiotic resistance, but there are several ways healthcare professionals and the public can help slow its development and spread. One of the most important steps is using antibiotics appropriately. This means taking antibiotics only when they are prescribed for a bacterial infection and following the healthcare provider's directions. Patients should not pressure a healthcare provider for antibiotics when they are not needed, especially for viral illnesses. Good Lord. Preventing infections in the first place is another important safety strategy. Simple actions such as proper hand washing, staying up to date on recommended vaccines, safely preparing food, and following infection control practices can decrease the spread of infection. When fewer infections occur, fewer antibiotics may be needed. Healthcare facilities also play an important role. According to Avrashina and colleagues in a 2021 article published in Frontiers in Microbiology, combating antibiotic resistance and healthcare-associated infections requires strategies involving infection prevention, improved diagnostics, and appropriate treatment. Healthcare professionals can also support antibiotic stewardships. Antibiotic stewardships means using antibiotics in a way that provides patients with effective treatment while reducing unnecessary antibiotic use. This can include determining whether an antibiotic is actually necessary and selecting the appropriate medication, dose, and duration based on the patient's condition and current clinical guidance. As patients, we can also ask questions. If you are prescribed an antibiotic, ask what infection it is treating, how you should take it, and what you should do if you miss a dose or experience a side effect. These actions may seem small, but when they're practiced across communities and healthcare systems, they can help slow the spread of antibiotic resistance. By using antibiotics responsibly and taking simple steps to prevent infections, we can all help slow antibiotic resistance. Now that we understand how resistance happens, why it matters, and how it can be prevented, let's review the key points we've discussed today. We learned that bacteria can develop and acquire resistance that allows them to survive antibiotic treatment. We also learned that resistant infections can become more difficult to treat and can spread to other people. Finally, we discussed how responsible antibiotic use, infection prevention, and antibiotic stewardship can help slow the development and spread of resistance. Antibiotics have transformed modern medicine, but their effectiveness cannot be taken for granted. The decisions made by healthcare professionals, patients, and communities all play a role in preserving these medications. By using antibiotics responsibly and taking steps to prevent infections, together we can ensure that antibiotics remain effective for ourselves, our families, and our future generations. Thank you. Ta-da!